Good evening everybody. Thank you so much for joining this live session. So today I will be talking on the topic diabetes. So if you know anybody who is dealing with diabetes, make sure that you're forwarding this link so that they will be benefited by this session. And before I proceed with the session, I would like to know where you're watching from. So if you can type the place or the city or the country you're watching from in the comments below, I'll be glad to know where you're watching from. I just want to talk about diabetes today because diabetes rates for both adults and children are going high in the recent years. We see that the diabetes disease is going out of control in almost all the populations worldwide. And when it comes to diabetes, also known as diabetes mellitus, it's a chronic condition which traditionally is recognized by high blood sugar levels in your body. So when it comes to diabetes, there are two types of diabetes. One is type 1 diabetes, also known as insulin dependent diabetes or juvenile onset diabetes, and type 2 diabetes is non-insulin dependent diabetes or adult onset diabetes. So when it comes to type 1 diabetes or the insulin dependent, what happens is your body's own immune system comes against the pancreatic cells or the cells that produce the insulin and destroy them. So the body doesn't have insulin in its place. So the type 1 diabetes or the juvenile onset diabetes require insulin to be supplied from the outside because your body cells are destroyed. When it comes to type 2 diabetes, this is the most common type of diabetes. Almost 90 to 95% of the diabetes cases come under this category. And this is called insulin independent because in this form, the insulin is secreted from the pancreas or the islet cells of the pancreas, but your body is unable to recognize it and use it. So this is insulin independent. Or the insulin or non-insulin dependent diabetes. So when your insulin is inadequate, the sugars in your blood will be going high, and that is the reason when you check for a diabetes patient, the insulin, the blood sugar levels will be high. So before understanding all this, I want all of us to know what are the symptoms of diabetes. Symptoms of diabetes include excessive thirst, extreme hunger. Even after you finish your meal, you still feel hungry. Unusual weight gain or weight loss, and then there will be increased fatigue or you will be feeling weak to do any kind of work. There will be blurred vision and frequent infections, especially in the skin, urinary tract and vaginal areas, and there is also numbness on the hands, on feet. So that's the reason most of the time the doctors give you a caution to check your feet and places like your hands and feet for sensation. This is one of the earliest symptoms that may present with. And delayed healing of wounds or slow healing of wounds. These are the classical symptoms of a diabetic patient. But the reason diabetes is also very important to know because it is associated with other diseases like heart disease, stroke, high blood pressure, peripheral vascular disease, cancer and obesity. So when it comes to diabetes, it is not just about the blood sugars, but the real reason for diabetes is cellular miscommunication. So diabetes is a disease which happens because of insulin and leptin signal, disease of insulin and leptin signaling. When it comes to type 2 diabetes, this is why we need to attend the root of the disease, not just the symptom. High blood sugars is just the symptom in diabetes, but the root cause of type 2 diabetes is faulty leptin and insulin signaling. Here I would like to just slow down and let you know what is leptin and what is insulin. Leptin is a hormone that is produced by adipose tissue or the fat cells of a human body, and leptin hormone plays an important role in recognizing hunger and your body weight. So this leptin will tell your brain when to eat or how much to eat, and most importantly when to stop eating. So when leptin levels, when the leptin hormone becomes resistant or body gets resistant to leptin, the brain doesn't get signals about when to stop eating. In other words, people need to eat more than required to make them feel full or get to that place of satiety. So leptin function is to make sure that it will help the brain to recognize when to eat and when to stop eating, and also it plays a important role in insulin sensitivity. And when it comes to insulin is primarily secreted by pancreas, that's an organ in our body. So when you eat sugars and grains, the blood sugars will go up. When blood sugars will increase in your bloodstream, that's the time insulin is secreted, and all that insulin will do is make sure that this glucose is transported to liver, fat cells and muscle. So in the liver it is stored as glycogen, but mostly it tries to send this sugar into fat cells and stores this sugar as fats, so that it can be making sure that it will use that fat whenever it is required. So liver, fat and muscle are the three important places where the insulin tries to push the glucose into. What happens is, whenever we need more energy in the body, whichever the muscles which have stored the glucose or the fats which have stored the glucose will release the glucose in times of energy, when we require energy. But the other thing with insulin is, insulin tries to reduce it, to move the glucose from the bloodstream into fat cells, making sure that glucose is not in the body, at the same time making sure this fat is stored in the fat cell and not releasing out. So in other words, main function of insulin is to make sure this glucose is stored in the fat cells, not to regulate blood sugars. So if you understand this, leptin and insulin, what happens when a person eats? Normally when a person eats, the blood sugars rise up, and the insulin will make sure the sugar goes into muscle or fat cells and the blood sugar goes down, and leptin is secreted whenever you are hungry by the fat cells. But when you keep on eating a lot of sugars, or when you keep eating a lot of grains, there will be a spike in blood sugar, and because there is an increase in the sugar, now insulin is secreted and making sure that sugars are stored as fat in the body. Because more sugars are coming, more fat is generated in the fat cells. Because of more fat being generated, more leptin hormone is generated, because leptin is primarily generated by the fat cells, and more the fat cells, more the leptin hormone. Lesser the fat cells or the leaner the body, lesser the leptin. But what happens is, when you're chronically having this raised leptin levels, the body reaches a place called leptin resistance. In this, what happens is, the body becomes deaf to the signal of the leptin. In other words, the leptin signal will not be enough for the brain to understand whether we are done eating or whether we need more to eat. So people will start eating more, or people will start eating more than required to feel that state of fullness or satiety. So leptin resistance, when leptin resistance happens, there will be more of fat cells, and then people start eating more because they don't understand when to stop, because the leptin hormone signals are not being understood, and because of increased fat cells, increased weight gain, and this causes insulin resistance. So when insulin resistance happens, the body cells will, or the muscle cells will not take in the sugars for producing energy. So blood sugars will remain in the bloodstream, and that is why a diabetic patient will actually show high blood sugar levels in their tests. So the cellular resistance is a real foundation problem when it comes to diabetes. So how to recognize this before even you see diabetes? This is how a patient presents when you are insulin resistant. This is called acanthosis nigricans. This is a dark patch of skin that will develop on a person's neck, or sometimes elbows and knees. This is the primary indicator for a person to know if he started becoming leptin resistant or insulin resistant in his body. So when you recognize this, you need to make sure that your insulin levels be tested at this time. The fasting insulin levels will give you an accurate things about whether your insulin is being pumped out and used properly. Normally the fasting insulin levels we recommend is keeping it less than 5, ideally between 2 to 3. These are the normal insulin levels. If your levels are above 5, fasting insulin levels are above 5, the best thing is to stop eating all forms of sugar and grains until you reach a fasting glucose insulin levels up to 2 to 3, and then slowly you can start introducing once your fasting insulin levels are normal. So every time we are addressing a diabetic patient, the two hormones that we have to keep in mind are the leptin and insulin. So if the leptin hormone starts getting resistant in your body, or the leptin resistance develops, the fat cells, the brain cannot get the signal from the fat cells about when to stop eating, and which will increase your hunger, and you start eating more. And when you eat more, the more the insulin is released to normalize the sugar levels, and the more the insulin levels for a long period of time, insulin resistant, and then your body stops responding to insulin. So today, in the time we have, I just want to talk about 5 important ways to normalize your blood sugar levels. First thing is exercise. This is one of the fastest and most powerful ways to lower your insulin and leptin resistance. When it comes to exercise, what you have to know is it's not about just sedentary lifestyle, but also prolonged sitting for a long time causes to shut down some of the insulin dependent pathways that will actually help to lower blood sugars. But when you start moving or standing, these cellular mechanisms will start operating. So in the recent research, it has been shown that a 10-minute walk after every meal has showed a very much good results in diabetic patients. And also exercise is important because when you start exercising, your muscle will start taking up the glucose from the blood and start using it as energy for your body instead of sending that sugars to be stored as fat. And also long-term exercise has shown benefits which will decrease the insulin resistance by the cells. When it comes to how much exercise, what kind of exercise, the better or the best thing is to make sure that you're working out at least from 30 to 60 minutes for most days of the week, at least 5 times a week. So running, cycling, swimming, whatever you're comfortable with, make sure that you're exercising in a week at least from 30 to 60 minutes. And as I've been mentioning in most of my videos about high intensity interval training exercises are always the best. And next thing is the diet. Diet is the most important factor when it comes to diabetes, as most of you know. But I want you all to understand this point in diet, that one of the most efficient way to train your body is to burn fat for fuel. Most of us start burning sugars for fuel. When you do this, when you start burning sugars for fuel, the reactive oxidation species or the ROS elements will be secreted in the body, and they will damage the mitochondria or the powerhouse of our cells. So instead of using glucose as your primary fuel, it is better to start using fat as the fuel. So you burn fat, and that's how obesity comes down, and that is the reason obesity and diabetes are linked. So for this, to burn fat as fuel, one of the best ways is intermittent fasting. When you start fasting for a prolonged period of times, what happens is your body will start using the stored fat or the fat stores for energy to be produced. And when it comes to diet, the rule is to limit carbs or to limit carbs and protein and replace them with healthy fats, and add more fiber into your diet. So what are the things that we can eat, what we cannot eat as diabetics are? the best foods that you can eat are non-starchy vegetables like cauliflower, broccoli, carrots, green leafy vegetables, and some Brussels sprouts, bell peppers, tomatoes. All these come under non-starchy vegetables, and you can have them. You can have meat like lamb or goat, and poultry like free-range chicken. You can have eggs and healthy fats like coconut oil, olive oil, ghee, grass-fed butter. All these are healthy fats that you can include in your diet. And also when it comes to beverages, it's better you shift to plain water, and if you are a person who drinks coffee and tea, make sure that you are consuming unsweetened coffee and tea. And when it comes to fruits, it's better you limit your fruit intake in a day, because fruits also have sugars in them, fructose in them. So limit your fruits like apples, oranges, berries, eat in limited quantities, and also dairy products like yogurt and milk. And when it comes to foods like grains, like breads, pasta, cereals, and starchy vegetables like corn, potatoes, and snacks like all your bakery items, candies, cookies, and beverages like sodas, sweetened drinks, tea, sweetened tea, it's better you completely avoid all of them, so that as we have discussed, it will help the blood sugar levels to come down in your body. And the next one is optimizing your vitamin D3. Vitamin D3 is linked to diabetes in many ways, and mostly for type 2 diabetes. But if you are a pregnant mother, it's better you maintain your vitamin D levels, because it will affect your child developing type 1 diabetes as well. So make sure that you're having enough sun exposure. If you have enough sun exposure in a day, that will actually equals to 20,000 IU of vitamin D in a daily requirement. So make sure your vitamin D levels are maintained between 50 to 70 nanograms per ml throughout the year. And next thing is probiotics. Probiotics are nothing but the healthy gut bacteria. Most of us have trillions of gut bacteria inside our gut, mostly in the large and small intestines. These bacteria are actually beneficial bacteria. They do good and not harm us. So when you maintain this good bacteria, your immune system will start working properly, because most of your immune system lies in your gut. So when you have good gut bacteria, your immune system will be balanced, and also other functions overall. So to maintain a gut flora, a healthy gut flora is the easiest of all. All you have to eat is start eating fermented foods like yogurt, homemade yogurt, kefir, some of the cheese. And in India, most popular are like ragi malts and dosas and idlis, that fermented foods. All this will increase the healthy gut bacteria. And also, if you feel like a supplement will help, you can take a probiotic every day, which helps in balancing your gut bacteria. And finally, stress. Stress can increase blood sugar levels in many ways. Because stress releases a hormone called cortisol. Cortisol, it contributes to high blood sugar levels, and also it increases the cravings for comfort foods like the snacking of bakery goods or the processed foods and the packaged foods. So in both ways, cortisol will increase the blood sugar levels. So attending or paying attention to stress is very important in diabetic patients, or people who already started having these symptoms, or who have a family history of diabetes, and people who are at the age of 50. So make sure that you are addressing stress in your life. And when it comes to stress, we shouldn't forget sleep. If you cannot sleep well, and again the same thing, the cortisol hormone will be released and the stress will kick in, and then the vicious cycle will start. So make sure that you're getting adequate sleep between 6 to 8 hours every night. And there are a lot of stress relieving mechanisms which we have discussed in previous videos as well, like doing something creative, writing a journal, reading books, listening to music, going out in a garden, all this will help you to will act as natural stress relievers. So once again, before I wind up, I just want to let you know that diabetes is actually a cellular mixed communication that is having at the cellular level between leptin and insulin hormones. And then exercise, diet, and D3 probiotic stress are some of the ways you can actually work on maintaining normal blood glucose levels. So make sure that you're paying attention to these steps and start making changes that are required in your life right now. If you're not exercising, make sure that you're moving your body and avoiding all the processed foods, and mostly exercise and diet will cure 90% of the diabetes immediately the moment you start working on it. You can start seeing the blood sugar levels going down very soon. And of course, D3 and probiotics and stress, one of the hidden factors, most of the times we miss out on it. So try to make sure that you are working on these steps. So thank you so much for joining this session. And if you have any more questions related to diabetes, or if you have any questions related to any other topic, make sure that you are sending me in the comments, or you can text, you can send a comment, or you can write to me in the DM so that I can come back to you. I can address those issues and will be able to give an answer as soon as possible. I have seen that most of you have written, and I'm trying to start working on the videos, the topics that you would like to listen to. So make sure that you write down in the comments what are the topics that you would like me for recording these videos or doing some live sessions that will be helpful for you. And thank you so much for watching this, and have a good day.